Welcome. My name is Donna Smith. I am blessed to work for the California Nurses Association and the National Nurses Organizing Committee. And I was one of the healthcare horror stories featured in Michael Moore's film, Sicko. I carried private health insurance, disability insurance, and a healthcare savings account when illness wiped me out. I went bankrupt. And unlike Donald Trump, and unlike any of the other CEOs my taxes are now helping to bail out, I will never again own a home or perhaps even carry a credit card because I got cancer. No bailouts for me, only punishment. So what will we put in place for this nation's healthcare system? Today's briefing will help us all compare state healthcare reform plans and specifically the Massachusetts model. As Congress moves forward on reform and as some point to the Massachusetts model as the roadmap for our nation. We will hear from distinguished witnesses, from nurses, doctors, economists, labor leaders, but today's panel does not feature a Massachusetts patient. In the stories I read on the California Nurses website, the guaranteedhealthcare.org website, we hear from many patients in Massachusetts. As I called their homes to seek a witness to come to Washington today, some numbers were disconnected, leaving me to wonder about the trauma that might have claimed yet another home or another livelihood as the healthcare nightmare continues. But then I reached one family, angry and resigned to a system in Massachusetts that has left them out and left them damaged. And I share these words briefly from Eugene Donovan in Rowe, Massachusetts. I am not poor, I am just cold. I am a retired educator with a gross retirement income of just under $36,000 per year for my wife and myself. My share of our yearly health insurance premium for the two of us, plus me and my wife's drug co-pays, add up to more than $6,000 per year. The adjustments I've made in order to keep my insurance are to eat mainly homemade soups and to use a very small wood stove I was able to purchase used for $150. In really cold weather, the stove can't bring the inside temperature above 48 degrees at a distance of more than 10 feet from the stove. So my wife, who has asthma, and I must spend most of our time close to that wood stove. We are one of the many who don't qualify for assistance because we're not poor enough to get the subsidies. The irony is that of the almost $120,000 in insurance premiums that I and my employer have paid to Blue Cross Blue Shield over the past 10 years, I calculate that my medical and drug expense that Blue Cross Blue Shield paid on my behalf came to less than $40,000. Well, Eugene, we're here today in DC to learn more about why things are not going so well for you after so many years of hard work and faithful purchasing of insurance, and why the Massachusetts model may not be the plan the nation needs. Moderating today is a new congressman of uncommon courage, a boundless energy, and hard-nosed intelligence to address the tough issues facing this nation. A 24-year naval veteran, a cancer survivor, a husband and father, and a man newly elected from the great state of New York, who is absolutely committed to healthcare reform on the basis of what is best for this nation, and in working hard to make sure he knows all the facts and all the evidence from all the reform plans before we move forward. It is my great and deep honor to introduce to you Representative Eric Massey.
What Donna may not have mentioned is that I had the pleasure of having her in my congressional district while we were campaigning. 10 years and 4 months ago, I was diagnosed with stage 4 non-Hodgkin's lymphoma. I was given 4 months to live. I decided that was not going to happen, and instead I chose a different fate. I ran and I became a member of Congress. Some will tell me I may have chosen the lesser of two evils. The reality is, healthcare and healthcare reform in a very real and personal manner got me involved in politics. It's why I'm here today. It's why I ran for Congress as an FDR Democrat in what some would call a Hoover Republican district, with a tremendous uphill battle. But the message that cuts across political lines is one that allows all Americans to seek health care, to go see a doctor. When I was being wheeled into surgery, it never crossed my mind to look up at the doctor and ask for his party registration. And yet somehow in this country, and perhaps there's blame on both sides, we have made what should be the most nonpartisan of issue one of the most partisan of issues. And until that ends, nothing else actually can begin. So it's an honor to lend my office, my energies to forums of this nature, so we can bring forth a lot of very smart people who know a lot about this subject that can help guide what our president said yesterday is the next great debate. But that debate must have a seat at the table for all parties.
Yes.
Now, I am and I have been a very strong advocate of single-payer health care, H.R. 676. And our voice must be heard. We must be allowed to be involved and to guide this process. We have been joined by a man who has taken point on this, who, when the wilderness was quiet, was the only voice out there on this topic. And frankly, it was through his leadership that I became involved. And I know that I beat him over here from voting only because I ran across the red light and he obeyed the law more than I did on that. And I'd like to defer to a man for whom I have great respect, our chairman, Chairman Conyers.
Thank you very much. What a turnout here. We have a full committee, Judiciary Committee going on, and Darrell Issa of California, and a member of the Intelligence Committee and the Judiciary Committee, and I were walking over, and we were saying, we were talking about a number of issues, and I wanted the record to show Dr. Himmelstein that he agreed to just walk in the room and show his face so that the record shows that he was here. Then we've agreed to a list. We said we can't talk about solutions yet, but we're going to exchange lists of problems. I can give him a list of problems, he's going to give me a list of problems, and then, look, this is how things start, right? And so I just want Congressman Issa to say hello to all of you folks for a minute. Give him a round of applause. Big round. He may come back.